interested in Medicare for All and that you support
Oh.
that. So tell us what that means, what that looks like.
Okay, so the biggest problem with healthcare in this country is that we have a profit motive. And healthcare, public education, and corrections ought not be for-profit industries ever. And in this country right now, all three are for-profit. So we need to remove the profit motive from our healthcare system. That's the first underlying problem. We do not need private insurance companies. We do not need to be raked across the coals by big pharma. We do not need any of those things dictating our healthcare in this country. So for me, Medicare for All is my number one priority. That's the biggest thing in terms of the biggest priority on my platform. I think that would make the single greatest change in the fastest time to most people's lives. I think the trickle up economy of that would be, I don't even think we can really conceive of it, because when you think about all the people that are struggling to pay for healthcare, well, if you have healthcare, now you can maybe afford to get a new car this year. Maybe you can afford to do some extra Christmas shopping this year. When you give people their healthcare, you're automatically injecting money into our economy, because the people that we are talking about will put their money back in. They're consumers. So healthcare, first and foremost, has to get done. And we need to take out the insurance company middleman. We don't need it. Every other developed nation in this world has one form or another of universal healthcare. Now, my suggestion, and this is just being reasonable, is that we look at what works best in those countries and we create something from that. You know, this is not rocket science. It's greed and a profit motive. That's it. We have the resources and we have the financial capability of having that. In fact, even the most conservative study done by the Koch brothers, this was probably like a few years ago already. The most conservative study says that Medicare for All saves us $2 trillion over 10 years. We have the worst health outcomes of all developed nations, and specifically for women of color. The maternal and infant mortality rates in this country for women of color is astronomical, and it's exponential to that of white women. So everything that happens in this country to all of us will affect our most vulnerable communities exponentially. That's just how it works. So yeah, to me, Medicare for All, I can't even negotiate it anymore. That's like arguing with flat earthers to me at this point. I'm done discussing it.
Okay.